This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised, and we encourage self-care and seeking professional support as needed.
But I think also with PSCA, people are so scared to report it. The victims are afraid to report it, and bystanders are very, very scared of retaliation, especially for people that have weaker contracts.
Erin MacDonald is WHO's full-time prevention and response to sexual misconduct technical officer, now based in Syria. She shares her field observations and highlights the loopholes and risks of sexual misconduct committed by aid workers.
But I still do think that when you have people that are named and shamed on social media by dozens of people, and they're still getting employment in the aid sector because the investigations were inconclusive, I think there's something very wrong.
To mitigate some of these risks, she suggests potential solutions.
I think donors could do a lot to put pressure on us. So I do think in cases where criminal background checks are feasible, maybe we could have a list of countries where that is possible.
This is the #NoExcuse podcast. We discuss the challenges, complexities, and potential solution in preventing and responding to sexual exploitation, abuse, and harassment in the humanitarian and development sectors. You'll hear interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and Global PRS Network Coordinator for the department. You've been in several high-priority countries with regards to the prevention and response to sexual misconduct. And you have a resume that includes working in countries like Sudan, Ukraine, recently accepted this new role in Syria. What drives you to work in emergency settings such as these and on a topic like sexual misconduct?
So my first emergency setting was South Sudan. I went there when I was 25 or 26. Mm-hmm. I kind of fell into that. But I think once you get used to working in emergencies, it's very hard to do anything else after a while.
Right.
I mean, I guess Syria will be my maybe 9th emergency.
Oh my goodness.
So I'm a bit used to this now. And I think also you get profiled after a while. Like they'll see you as an emergency person and then that's where you end up being placed.
Right.
But I think also it's very difficult, but it's also very meaningful because the needs are very significant. The SIA risks are very, very significant in emergencies. Yeah. It unfortunately does offer an environment for people to be abused. So I perceive the risks as being very high. And it's also something I became aware of early in my career that this is a risk. I think a lot about how these risks kind of show. Mm-hmm. I feel like maybe I could do something to support this. But I think also, it is really important that this gets attention. And I think in emergencies, the risks are so high. I mean, they're high from the vendors and contractors, they're high from the government, and they're high from the UN staff themselves. So there's just so much work to do on this. So that really kind of gives me a passion and motivates me.
Erin, what are some of the challenges you've seen when it comes to reporting allegations of sexual misconduct?
But I think also with PSCA, people are so scared to report it. The victims are afraid to report it, and bystanders are very, very scared of retaliation. I don't know if I should say, but I think the mechanisms for protection from retaliation are not very strong. Yeah. Especially for people that have weaker contracts. Mm-hmm. They're putting their career on the line, and it's very, very hard to protect them. And I think also retaliation can be very subtle. And you don't know who is going to influence somebody else, right? In 10 years, you could have somebody on an interview panel that was a friend of somebody you informed about a long time ago. So I've heard of these kind of stories happening. So it can be very difficult.
What are some of the little wins that you've experienced which motivate you?
I think for me, as I said, like the Me Too movement was a really big win, and then the Aid Too. Mm-hmm. So I did a dissertation on that because I was really inspired. And I think also just the attention that WHO gave to this subject after the really horrible allegations from the Ebola response came out, and just the fact that the perpetrators were actually named and shamed, and that there was an independent investigation, I think was very important. I think it brought a lot of credibility.
Yeah.
So I think that was a big win. And of course, I can't give identifying details, but when I hear of, or when I have my staff in the field in other countries, not where I am now and not with WHO, but in other places I've worked where I do hear that survivors and victims have actually come forward.
Yeah.
And they've gotten the courage. And in some cases, the perpetrators have been at least fired. I feel pretty inspired that, at least things are slowly changing.
Like there
and
is hope.
People don't always feel that they have to stay quiet.
What would you want to see as a change?
I think we have to be a lot more punitive. I think the culture change is very important. But when you have, unfortunately, the UN and the aid system is full of sexual predators. That's why I used the example of the priesthood. I mean, in Canada, one of the most prolific pedophiles we had founded Street Kids International. A lot of people knew what he was up to, but he wasn't apprehended until he was in his 60s, and it was by the police in Nepal. It wasn't by any of the organizations he worked for, including WHO.
Yeah.
So, I mean, okay, imagine you had somebody like that taking a course, and then look what he's doing. So, I mean, he intimidated all of his potential victims or witnesses, and that's why he got away with it for so long. So I think these culture changes are very diplomatic. I do think we have to be kind, but I also think that we need to stop impunity. And I think these people that are known perpetrators need to be punished. And I think it's very, very hard to get the evidence.
Yeah.
Especially given the nature of GBV or sexual exploitation. By the time people are willing to talk about it, such a long time has passed. And I think also, I mean, I was told recently that our standard is now more likely than not, rather than clear and compelling evidence or beyond a reasonable doubt, which I think is a good first step. But I still do think that when you have people that are named and shamed on social media by dozens of people, and they're still getting employment in the aid sector because the investigations were inconclusive, I think there's something very wrong. I mean, all of these people in different parts of the world who don't know each other, I think it's very unlikely that they mob together to ruin someone's career.
Yeah.
It's possible, but I don't think it's likely. So when these cases come up, I do believe that we have to take a much more victim and survivor-centered stance.
Yeah.
And I do think that when there are egregious cases with overwhelming evidence, I think we should publicly shame the person. I mean, I don't know if all survivor and victims' rights would agree with that, but I do think it needs to be very clear that these people, I don't know if clear check will be enough.
Yeah.
Or the NGO safeguarding scheme, I'm not sure how comprehensive that is. And then also when you think about some of these people may go back to their home countries and they could join church groups, they could join civil society organizations that don't have the capacity to weed these people out. I think it should be in the media. Not in all cases, but in cases where there's very, very overwhelming evidence, which there is in some situations.
With regards to WHO making, the dashboard being kind of public of the investigation, of course, keeping the name of the perpetrators confidential, but there is a track record that is publicly available of that. What do you feel, and what's kind of your response to it, or how do you receive that transparency?
Actually, I do think it's a very good idea. I think it does tell people that things are moving, and it is numbers. And I think also when you tell people that for every case that is reported, there's many, many more that aren't.
Yeah.
I think it does put things a little bit more in perspective. I think some of the metrics on that dashboard could be a bit more detailed. Just given the trainings I do, people do usually ask a lot more questions. So they will say, okay, of the cases of sexual misconduct, how many are harassment, how many are exploitation? And they usually want to know not just where the case is closed, but what was the punitive action?
Yeah.
So I think that, because those are the questions that I get a lot of the time. So I think that could also definitely help if people saw what the, what the outcome was.
I hear you. And do you think there's space for prevention when we are in an emergency setting?
I definitely think there's space for prevention, and this is where I think the humanitarian community and the one UN has to be much, much stronger. So I do think ClearCheck is a very good initiative, or the safeguarding schemes that NGOs have are very good, because it should be a lot easier to prevent these people from coming. So I do think, at least at the international level, and in many countries, they do have the governmental institutions to do criminal background checks in a quick way. Not every country can, but many do have the ability. And where it's possible, I think we should definitely make use of it. So I think prevention is absolutely possible, but I think we have to have more coordinated systems for that, for sure. I think donors could do a lot to put pressure on us. So I do think in cases where criminal background checks are feasible, maybe we could have a list of countries where that is possible. Like criminal background checks, like I've only given one criminal background check in my whole life in 15 countries, and it was in Rwanda. I was required to bring that from my home country before I could get a work permit.
Right.
So I know some countries would be so corrupt, or they would have such weak institutions that a criminal background check would not be very valuable or possible.
Right.
But I think in the countries where it is possible, people with a known criminal history, it's pretty easy to weed them out, right?
Yeah.
So why aren't we using some of these easier wins?
Yeah. I totally agree with you. In Switzerland, it's a standard for the private sector to request for criminal background checks. It does get a bit tricky if you've been moving around, working in different countries. And in some countries, obtaining a criminal record, I guess implementing mandatory criminal checks might get a bit complicated in those situations.
Yeah, definitely. And I mean, even for me, I don't know how relevant a criminal background check is from Canada when I haven't lived there in 10 years, but it's possible. I mean, there's no such thing as a perfect system, right?
Yeah. But the more you can
yeah.
enforce preventive measures, the better. I mean, hopefully we can reduce those risks. Yeah. Well, Erin, thank you so much for sharing with us and being so candid. Anything else you'd like to share on the podcast?
I think it's a really cynical subject, PRSM, especially when you get into exploitation. It's really quite awful to think about, but I hope it's something we all keep in the back of our minds because unfortunately it's happening.
Yeah.
So I think it's something that we should always be mindful of, even if it's not our own scope of work, to just do our part and do what we can in any way to stop it.
I'm thinking of one more thing, as you were saying, it's happening. And some people think or believe be it in the European region or in countries or in regions that it looks like it's not happening. And with your experience in Ukraine, and of course Ukraine is in an emergency right now, but what would you say to the typical skepticals on the topic of sexual misconduct, but some might not feel that this is something that exists, or it doesn't involve them, or it doesn't affect them?
I would tell them a few things. So I think according to WHO's data, an average of 1 in 3 women in the world has been a victim of sexual violence or intimate partner violence. One or the other. There's some regional data from WHO. So the regions that have the lowest prevalence, like my own region, it's still something around 20 to 25% of women have experienced this. So that's at the lowest prevalence, it's 1 in 4 women. So I would tell them, if you're saying that gender-based violence isn't happening, you're being pretty offensive to several women here.
And even though it's a very difficult topic and a sensitive topic, to end a bit on a higher note, what makes you hopeful of this, on this subject?
I'm a firm believer that the truth comes out eventually. It can take a very long time, but I think it does come out. I think also the tide of justice tends to move in the right direction. It doesn't move fast enough. But if you're a woman, you're an oppressed minority, you're an LGBTQIA plus person, you're a person with a disability. In most parts of the world, with some exceptions, you're better off now than you've ever been in history. So I do believe that things do slowly move in the right direction. Like when you look at the Catholic Church, I was not raised in this, but I know people who were, and they couldn't even have imagined that this institution could ever be challenged. But it was. So these things can happen, but it does take time. But I think if you're persistent enough, these things do come out. So that's something that keeps me optimistic. But I think for the survivors and victims, it's
a harder...
It's just too long. So they try to stay optimistic, but I think for a lot of people, the wait is very difficult. So we have to try and make our systems more effective, which we are slowly.
Thank you for that. Thank you for listening to this episode of the World Health Organization's #NoExcuse podcast. We hope we've given you another perspective on preventing and responding to sexual misconduct in the humanitarian and development sectors. We release new episodes every 2 weeks, but if you have any feedback, questions, or suggestions in the meantime, feel free to reach out at prseah@who.int. Until the next time, goodbye.